Today, at Math, Magic and Mindsets, we are joined by Dr. Hitesh Garg, the head of spine surgery at Artemis Hospital. With over 14 years of experience and advanced training at Yale School of Medicine, he specializes in advanced orthopedic spine surgery. Dr. Garg, welcome to Math, Magic and Mindsets. Here, we explore how mathematical thinking shows up out of books and how it shapes decision making in real life. So to start off, how does mathematics even come to play in a field like spine surgery?
Thank you, Divyansh, for having me here at your channel. So this is very interesting because when we enter into our 11th standard, we are told that if you go into biology stream, then maybe you don't need to read mathematics. But you will be amazed to know that the entire field of spine surgery is based on mathematics, actually. You need a mathematical bent of mind. In spine surgery, the decisions that are made, that okay, when to operate on this patient, when not to operate on this patient, whether we should treat this patient without surgery, it is based on some decisions which are based on research. And how is that research conducted? So we conduct the research on hundreds and thousands of patients, and then we apply statistics, which is entirely mathematics, to understand that which treatment is working in which patients and which patient deserves the best form of treatment, surgical or non-surgical. Now this entire study, the entire research methodology is entirely mathematics. That is number one. Number two, the entire revolution in spine surgery came when we started understanding the alignment of spine. Now you know that the spine is a very complex structure with a lot of curves, right?
Yeah.
So there are a lot of natural curves. We should know what is the natural alignment of the spine and what is the alignment of the spine which we need to correct with exercises or with postural correction or with surgery. Again, when we plan the surgery, again we have to go into these mathematical details, this entire geometry. So we take standing x-rays of the patient, we then measure the angles and then understand and compare these angles with something which is normal, which has again been studied doing research using statistics. And then when we are examining the patient, again we need to have a mathematical bent of mind, because we have to combine a lot of symptoms of the patient to reach at a diagnosis. So I think what is happening is, even a patient expects from us that maybe it's mathematics, that okay, I have these 10 points, that means I have this disease and this is what is needed. So the understanding of the patient's symptom, making the diagnosis, planning the treatment and reaching that decision is entirely mathematics. But yes, it is not pure mathematics. We say that medical science is not absolute science, but both the patient as well as the doctor ultimately are using their mathematical bent of mind to treat a patient in spine.
Wow, that makes a lot of sense. I've never really thought about how math can be used this much in medical science. So, you've studied at both India and US, especially you've trained at the Yale School of Medicine. So I would like to ask, how does mathematical thinking in medicine differ from India and the US?
See, mathematical, because Indians are born mathematicians. We say we have a mathematical bent of mind. So I mean, it's no different that even in India, when we were examining the patient, we were using our mathematical bent of mind. One difference that I would like to point out was that in India, as I told, when we entered our 11th standard, we were told that okay, mathematics is out, it's entirely now biology and stuff like that. But when I was at Yale, even my attendings, my consultants, they have these integrated courses where they were studying mathematics, they were studying business studies, they were studying economics along with their medical science, so that they could use this in practice to improve the lives of their patients, to improve the general health of the society. So I think those integrated courses play a very important role. Another big difference was here when we were studying, we were basically studying, okay, in this patient we have to do this, in this patient we have to do this, if the patient presents with these symptoms, we have to do this. When I was at Yale is primarily a research institute, so actually I came to understand that how do we reach these decisions, what sort of research is involved to reach at that decision that this particular treatment is needed for this patient. So when we go into those basics, where again mathematics plays a big role, and then we are trying to analyze every patient from that bent of mind that, okay, this is the theory behind the research, this is how this decision was reached, and whether this decision is appropriate for this particular patient or not.
Wow, makes a lot of sense. So, do you think your experience at Yale has changed the way that you think?
I think yes. As I told you that initially we were studying that, okay, this particular treatment has to be done for this patient, but at Yale, when we went into details why this treatment is being done, like in spine surgery we put a lot of screws in the spine, so why this particular size of screw is being used, why I mean we use 4.5 mm, 5.5 mm thickness, why these screws are being used, this is the size of the pedicle. Again, it's all mathematics. We do the CT scan, we study the size of the pedicle, and then we select the type of screw that is used and why this particular type of screw is being used. We study something known as pull-out strength. So in this particular patient, maybe we use some different type of screw to increase the pull-out strength, maybe we use cementing. So in this entire thought process is entirely mathematical, and this has significantly changed when I was at Yale. I would give you one very good example is tuberculosis of spine. Tuberculosis of spine is very prevalent in India, and in India the general treatment that was taught to me was that, okay, in tuberculosis of spine, if there is a neurological deficit, we should operate. If there is no neurological deficit, we should just give medications. Now, why this decision was made was because in India the number of patients was too much, and Indian hospitals were not able to serve so many patients, so they devised a method that we should operate only on the patients who needed the surgery the most. So when I was at Yale, I went into the details that how these decisions were made. Actually, I came to know that it's pure statistics, that how we can operate only on this number of patients, this is the capacity of the hospital, but this is not the best form of treatment. The best form of treatment maybe is to debride the infection, reconstruct the column so that we can stabilize the column. So it was mainly surgical in most of the patients. So there is a difference between a treatment which has to serve the masses and which is limited by our capacity, and compared to a decision which is best for a particular patient. So this entire thought process changes. So I would say the research bent of mind, the mathematical bent of mind, I think became much more in examining my patients and making treatment decisions for my patients after coming back from Yale.
That's amazing. So mathematics is really useful even in spine surgery.
Yes.
So I would like to ask you, in mathematics, the process or the working, which students hate to show, is as important as the answer. How does this relate to spine surgery?
Again, very, very important. It is the same thing. Like in mathematics, you can arrive at the answer through various means. I mean, you can just use a calculator and you arrive at the answer, but that is not the mathematical bent of mind, I think. And same is in spine surgery. So again, as I was telling you previously, we should understand the methodology. Why are we arriving at this decision in this particular patient? I treat a lot of scoliosis patients. In scoliosis, there is very simple, we measure Cobb's angle. It's all geometry. So we take a standing x-ray, we take the most tilted vertebra, and we measure the angle between them, and we say this is the Cobb's angle. And the standard teaching is, if the Cobb's angle is more than 50 degrees, we operate. If the Cobb's angle is less than 50 degrees, we observe. But how did we reach this decision? What is the process behind that? That changes your entire thought process. And that is what changed when I went to US. Because if someone's angle is increasing, like someone is 40 degree, in the next 6 months it becomes 42, then it becomes 44, then it becomes 48, and then it becomes 50. That means this angle is getting worse with time, the disease is getting worse with time, and this is the patient which we should operate. Of course, we take a lot of other factors, age of the patient, what height are we achieving, what is the growth potential of the patient. We take a lot of factors into account. But compare this to a patient who comes to me with just a 50 degree angle of Cobb's angle, and it stays 50 over the next 5 years. In this patient, maybe I would just say, just observe. We don't need to operate because this angle is static. So if we go into the process, that how we came out this figure of 50 degree, and what is the process behind that, what is the research methodology that was used behind that, and that helps us to understand and make proper decisions for the patient.
Yeah, that makes a lot of sense. So when you learned math in school, is there a concept in spine surgery which you thought would never come into play but is used a lot?
Yes, I mean, when we were studying, we were always using these angles, that opposite angles are equal, and we draw two parallel lines, draw a line and say and calculate the angles. And we thought it will never be used in mathematics, in medical science, but it is used everywhere. I mean, this is a very, very simple concept of angles and in geometry, which is, I mean, and I know a lot of my friends at my schoolmates, they were afraid of this and they were used to avoid this, but this is in everyday life. In medical science, the entire decision making is based on measurement of these angles in spine surgery. So we measure these angles, we apply that to the patient, and then we make our decision. Okay, this patient needs surgery. The planning of the surgery is entirely based on this. Even our MRIs, our CAT scans, the reading of these MRIs and CAT scans, we try to bring everything into that mathematics. Like even when we are doing the MRI, we are measuring the canal size, we are measuring the size available for the spinal nerve, the spinal cord. So what we are trying to do over a period of time is we are trying to make everything mathematical, so that everything is well defined. The reason is, why are we trying to do this? So that everything is well defined. We know if we do this today in this patient, tomorrow this is how he is going to behave, so that it becomes predictable.
So spine surgery is basically a form of applied geometry, you may say.
I mean, this is one concept. It's not that it's only applied geometry. We use algebra, we use geometry. So I mean, we are using almost, I think, even trigonometry. We are using every branch of mathematics in medical science, in spine surgery, and this may be similar in other branches of medicine. And it depends on what area you are practicing. Like if you are into practice just looking at the patient, maybe using these concepts. If you go into research, then you are using much more mathematics even than this.
Makes sense. So I'm just going to list out some processes, and could you give us the math behind those processes? So first is reading an X-ray.
Reading an X-ray, I have already told you, the entire reading of X-rays in spine is based on mathematics. In spine, we study the alignment on X-ray. So what angles have changed, whether whatever are parallel. We study these. I mean, the latest concept is we study something known as sagittal alignment. That how your head is positioned over the pelvis when we look from the lateral side, and what is acceptable, what is not acceptable. So this entire is mathematics.
Makes sense. So correcting a curved spine.
Again, correcting a curved spine. So right now what we are doing, of course, we have now developed computer programs, software programs who can tell us exactly, but it is basically we measure the angles. So we study the spine, we study the CT scan and the X-rays of the patient, we make a model of that patient, we study various angles, and then we also know this is what we want to achieve. These are the angles we want to achieve at the end of the surgery, where head should be perfectly balanced with the pelvis, shoulder should be level, these are the angles. And how do we achieve that? By doing something known as osteotomies. So how much bone do we need to cut? So everything is pre-planned. And the future of spine surgery is robotic spine surgery. The entire robotic spine surgery is based on this process of mathematics, of calculating the angles and achieving the desired result.
So you've already talked about this before, but deciding whether to operate surgery on the patient or not operating surgery on the patient.
Yes, this is again, I think again we are trying to make it predictable, we are trying to make it mathematical so that it's easy for everyone to understand. But of course we need to understand the process behind it. So research, arriving at a diagnosis, arriving at that entire is mathematics. Then once we are making a decision for the patient, again nowadays we are going into the alignment in spine surgery. On X-ray, so we measured many kind of angles, and the entire revolution actually was based on mathematics. One who is very good mathematician, he can study at the angles and maybe in the future come up with more mathematical assessments of the X-rays and come out with a better plan which can actually help improve the lives of these patients.
Yeah, makes sense. So to sum up the session, let's play a game of myth or reality.
Sure.
So after you become a doctor, math is not useful anymore.
Oh, this is totally wrong. This is a myth.
So you don't need to be good at advanced concepts like calculus to be a good to go into the field of medicine.
I think partially right. I mean, you don't need to be a pro. It depends on what area you want to go. But if you want to do research and you want to come up with new concepts and improve the lives of patients at large, and then I think it's very important that we go into advanced concepts of mathematics like calculus.
Makes sense. So dropping math after 10th grade has no effect on your thinking and how you perform in a medical career.
See, of course, I dropped basic mathematics. We are not going into mathematics, but I strongly recommend that mathematics should be a part of medical science. In fact, to some extent it is. Statistics is entirely mathematics, and it is a subject in medical science throughout your curriculum. But it should be read in much more refined and much more advanced methodology should be used. It definitely, if you leave mathematics at 10th standard, it definitely affects your mathematical thought process and affects the way you treat your patients.
So thank you for your time, Dr. Garg. This was a really insightful session. I hope to meet you again.
Sure. Thank you.